І поки ніхто не приєднався.
Класно. 4 учасники. We can, що це англійською, Діана. Ми зробимо запис, він у нас буде в наявності, і якщо буде така необхідність, ми просто його викладемо десь там, або просто викладачам груп роздамо, та й вони будуть собі дивитися. Тому що змісту їх півгодини, я вважаю, не мають чекати, це затягнеться ще Бог знає наскільки. Тому я почну, а просто ми записуємо те все. Так. Well, today we are going to discuss breastfeeding. Actually, these are 2 lections. They are combined in one because they are joined on the same topic. So what is the plan of our today's lecture? Breastfeeding definition and advantages, breastfeeding benefits for mother and her child, basic rules of breastfeeding organization, indications for later breastfeeding and contraindications to it, problems influences breastfeeding and their correction, and introduction of solids. So every time when you study the topic of breastfeeding, you need to understand advantages. You need to understand why every time when you deal with communicating with a breastfeeding woman or a woman who is going to give a birth to a child, and you are planning to consult this woman, you need to be ready to explain here why, in general, breast milk is significantly better than formula, because actually formulas are substitutes of the breast milk, which are based on some animal's milk and which are artificially enriched with actually everything the child needs. So the question maybe, and it's a very logical question, why should we actually feed with our breast? Yeah, why we should feed with breast? Why should we spoil the shape of our mammary glands and so on and so forth? Why shouldn't we do all this hard work and so on and so forth? So actually, you should be ready to explain breastfeeding woman why it really so good to feed the child with the breast milk. So first of all, the first advantage is that the breast milk is absolutely a live structure, and formula instead is dead. So what does it mean? What does it mean? Breast milk, if you leave it during 12 hours, just staying in room temperature, you will find out no pathological growth of any bacteria. And at the same time, formula, if you leave it during 12 hours, at the end of these 12 hours, you will find out numerous bacteria present and colonizing the plate with formula. The next advantage, the breast milk contains as many vital cells as blood does. And sometimes even the breast milk is called white blood. Why? Because it contains leukocytes, monocytes. It contains a lot of factors of immunobiological protection and so on and so forth. And if we're talking about formula, no vital cells and antibodies are found there. Breast milk provides immunity regulation. Various microbes in formula, in artificial formula, are the only vital substances present here. Breast milk is a pure and absolutely natural product. It ideally corresponds to child's growing organism needs and is both good for, it's both for mother and for a child, and it's good food and medicine. And formula at the same time often contains pollutants and often contains plumbum, which is neurotoxic element and may cause different neurodegenerative problems, toxic effects upon the brain, and so on and so forth. So what are breast milk hormones? Breast milk hormones present in the breast milk are adrenosteroids, calcitonin, erythropoietin, which is very important for stimulating, promoting of erythrocyte synthesis, growth hormone releasing factor, which helps to the growth, which enables the growth hormone to act easily and faster, gonadotropin releasing hormone, insulin, neurotensin, oxytocin, prolactin, somatostatin, triiodthyronine, and thyroxine. You see how many hormones are present in the breast milk. I ask to attract your attention on that there are no of these hormones present in artificial formula. And at the same time, there are also growth factors which promote the ideal, harmonious physical growth and neurobehavioral maturation of the child. They are epidermal growth factor, breast milk growth factor, derivative growth factor, neuro growth factor, converting growth factor, colonist growth stimulating factor, and beta factor of the growth. Also, the breast milk contains specific enzymes, which are, for example, amylase. And you already know it from biochemistry, from physiology, that is responsible for digestion of polysaccharides. Lipase is also present in the breast milk, and it's extremely needed for decomposition of fats. Proteases, which are needed to decompose the proteins. Xanthine oxidase, which is responsible for carrying of iron and molybdenum. Alkaline phosphatase, which is responsible for carrying of zinc and magnesium. Antiproteases, very important factors. They are responsible for protection of bioactive components like enzymes, immunoglobulins, and hormonal growth factors. Sulfhydryloxidase, it supports the breast milk protein's normal structure. Peroxidase is of anti-infectious action. Lysozyme is of bactericidal action, and lipases are anti-infectious agents. And here's a very important thing which you are very often asked actually during practical classes and on the exam. Differences between human's milk, cow's milk, and formulas. So what are they? Bacterial contamination. First of all, as we have already discussed before, bacterial contamination is absolutely absent in the human's milk. And even now it is believed, it's recommended not to wash the mammary gland, the breast, before feeding the child. And it is explained by that those first milk drops which are expressed before feeding, they are enough to, we can say, to cleanse, to sterilize the skin of mother, to kill all bacterial and viral agents, and to be enough clean to start feeding the child. And of course, if we're talking about cow's milk or formulas, which are based on animal's milk, bacterial contamination is very possible. If we're talking about anti-infectious factors, so in human milk, which is also called white blood, we have antibodies, leukocytes, and many other immunobiological protection factors. And of course, they are absent in cow's milk and formulas. The same about growth factors, we have seen it previously. And also, if we're talking about composition of protein, which is a very important thing, we know that the human's milk and animal's milk, it has basically two main fractions of the protein. And these fractions are casein and serum proteins. If we're talking about differences between these two fractions, we may say that casein is more hard, is more heavy. Its molecular weight is higher. And that's why being present in the stomach, it creates very hard emulsion, which is slowly evacuated to the duodenum, and then it's slowly digested and slowly assimilated. If we compare serum proteins with casein, of course, it's of lower molecular weight, it's more light, it's easier to digest, it's easily to be absorbed. So if you see, we have very good, very favorable correlation between serum proteins and casein. Serum proteins predominate in the human's milk, which make it digestion faster, easier for the child. And if we see, if you look at cow's milk and formulas, we can see that in both cow's milk and in formulas, we have predominating of casein, which make both of these substrates, cow's milk and formulas, less easier to digest, less easier to absorb, and in general, worse, in this direction. Amino acids and human milk are presented by ideal balance. We need all necessary amino acids are present there. If we are talking about cow's milk and formulas, we have lacking in some essential amino acids. Fats, 4% we have of the fats in average, and it's characterized the fats composition by the enough essential fatty acids compound. And if we're talking about cow's milk, we can say that the presence of fats makes 3.5%, and there is lack of essential fatty acids. And if we're talking about formulas, there is also the lacking in essential fatty acids, and in general, the contents of fats makes 2.4 to 3.6%. Lipase, an enzyme needed to digest fats, is present in the human's milk, and it makes it easier to start digestion fats starting from the stomach already. It means that when it passes into the small intestines, so the fats are already semi-digested, and it's easier for them to be absorbed than from the duodenum. So again, the process of digestion becomes easier in general. And lipase is absent in cow's milk and formulas based on the animal's milk. Lactase is an enzyme which is necessary for splitting the lactose, the carbohydrate of the milk. So we have 7% of it in the human's milk, and it's absolutely enough. And it's extremely important because many of newborns, especially premature newborns, they have immaturity of the enterocytes, and especially their function, the ability to produce lactase. And that is why it's so actual to have enough lactase present in the breast milk in order it could help in case of deficiency of the PROPA, the child's lactase, to split the lactose. And if we're talking about cow's milk, we have just 3-4%, and it's not enough. For example, if the child has deficiency of lactase, this presence of lactase in the cow's milk wouldn't be enough to cover this deficiency, and the child will develop lactase deficiency signs or lactose intolerance signs. That is the same. If we're talking about formulas, there are another types of sugar, and that's why it can't be comparable here. If we're talking about minerals, calcium and sodium, for example, calcium presence is significantly lesser in the human's milk, but at the same time, it's easier digested completely. All of these quantities completely digested from the duodenum, from the small intestines. And the same situation is with the sodium. But at the same time, if we're talking about calcium in cow's milk, it is 58. It's significantly more than in human's milk, but due to significantly lower degree of absorption from small intestines, and a significantly lesser amount of it is absorbed, and those children who are not breastfed, who are artificially fed, they may easily even develop such disease as rickets, which is developing on the background of deficiency of calcium and phosphorus in general. If we're talking about formula, there is less calcium and sodium than in a cow's milk, but more than in humans one. It's something in between, but again, we have significantly lesser degree of absorption. Iron, small quantity is in the human's milk, but it's perfectly assimilated. Almost all iron present in the breast milk is ideally assimilated from small intestines. In cow's milk, again, it's small quantity, and at the same time being present in the small quantity in the cow's milk, it's poorly assimilated. And that is why these children who receive feeding with non-adapted cow's milk, and we still have this situation, for example, in Ukraine, it's quite a widespread tendency in countryside and villages like that. So our children may still be fed with animals, with cow's milk, goat's milk, and sheep's milk. So they are in a group, these children are in the group of risk of iron deficiency development. And if we're talking about formula, iron is artificially added. And you should remember that being present again in the higher quantity than in the human's milk due to poor assimilation, again, there is high risk of iron deficiency development in these children. Vitamins are quite enough in the human's milk, and the same about water. If we're talking about cow's milk, there is lacking in vitamins A and C, and water should be added. You know the principle how formula are soluted. And the vitamins in formula are artificially fed. And again, the same principle as it was with iron, quite poor assimilation is present, and water for formula may be not enough or exceeding quantity in incorrect mix. So it varies. If we're talking about breastfeeding advantages for a child, as we have already discussed, there are advantages for both, for child and for mother. So you should know exactly what should you exactly explain the breastfeeding woman who thinks of a probable refusal from breastfeeding. So what should you explain here? For example, the first position is the decrease of sudden infant death syndrome. You know, sometimes the neonate dies. It dies of some unknown reasons, and scientists all over the world try to understand what is the basic problem when the child suddenly dies, absolutely healthy child suddenly dies. So they still don't find any evident answers. Different theories are discussed, but there is no some unique understanding of the problem still. But one thing is absolutely fixed, is that those children who are breastfed, they have significantly less rate of sudden infant death syndrome rather than those ones who receive artificial feeding. Then decreasing of rates of diabetes mellitus, otitis, and cancer even risk. So I think that these are quite prominent advantages which may attract attention of breastfeeding women and change her opinion to refuse from breastfeeding. Better reaction on vaccination. These children who receive breastfeeding, they have less rates of different complications and side adverse reactions of vaccination. And it's also quite important. Decreased jaws and teeth problems later on when the teeth will be already, yeah. So it's also important thing. And better psychomotor and emotional development of the child. When the scientists have studied intellectual quality coefficient, they have found out that it's higher in those children who are breastfed, and also they have noted that those children who were breastfed during first year of life, later on in life, especially in pubertal period, these children are less tend to have some criminal behavior rather than those children who were absolutely artificially fed. And also we have breastfeeding advantages for mothers. They are stimulation of postpartum hemorrhage stop. So hemorrhages postpartum stop earlier significantly in those women who are breastfeeding. Increasing of energy reserves, decreasing of ovary and mammary gland cancer risk, but it touches only those breastfeeding women who breastfeed for more than 8 months actually. So that is why it's important to support breastfeeding for not just 1 month, 2 months, 3 months, it's not enough. But if the breastfeeding woman is interested in this effect of decreasing of ovary and mammary gland cancer, so you need to explain her that it's important to feed during prolonged period of time, more than 8 months. And menstrual cycle faster restoration, also one of the benefits for breastfeeding mother. So you're very often asked by us on practical classes and during your exam, when should be the child first applied to the breast? So the first applying the child to the breast should occur as early as it is possible within first 30 minutes of the child's life. And what are reasons why we need to do this? The first answer is that first early applying the child to the breast stimulates lactation. And it is considered to be one of the best and one of the most prominent stimulators of lactation in breastfeeding women. First. Secondly, there is colonization of the child with positive maternal microflora. And third reason why we should do it, that is to set very positive psycho-emotional contact between mother and her child. And actually, this is a huge method of prevention of hypogalactia and its prevention of postpartum depression and so on and so forth. And here you can find out the marked with green pictures. This is how is correct to apply the child to the breast, and lower pictures, they demonstrate you how you shouldn't do this. The thing is that if there is a mother who gave her first childbirth, she may have no skills how to correctly apply her child to the breast. And being a doctor should be able to explain her these methodics, because it's of extreme importance for both mother and the child how correctly the child is applied. Why? Because first of all, take a look on the picture C. The child captures the nipple without covering the areola. And what will it be as a result? While sucking, this child will swallow a lot of air, first of all. And this air will be accumulated in the stomach, then it will be accumulated in the duodenum. It will cause constant regurgitation. It will cause meteorism, bloating, sometimes even constipation if being collected in great amount in the intestines. Also, the child will work hard by sucking this nipple, but he will swallow more air than food, but he will be anyway exhausted, stop sucking the breast, and as a result, the amount of milk he receives will be significantly decreased, and the child will stay underfed. For mother, we also have negative signs of this incorrect applying the child to the breast, is that if the child captures exclusively the nipple, there will be features of the nipple, and usually they are associated with an extreme pain, and it's quite significantly painful for a breastfeeding woman to breastfeed her child from this breast with fissures later on. So another important position, how to understand either mother has satisfactory lactation. First of all, cylindrical form of mammary glands. Secondly, marked pigmentation of the areola around the nipple. Skin temperature under the mammary gland should be 0.5 to 1 Celsius degrees higher than in an axilla. Mark venous net on the skin of the mammary glands. In slight expression of the breast, the milk is flowing out with jets, not drops. So if these or majority of these signs are present, you can understand that the quantity of milk is adequate. Sometimes we have situation when the child can't be applied to the breast, as we have mentioned during first 30 minutes after his start of his life, after his birth. So what are these conditions? They are divided into those conditions from the child's side and from the mother's side. So what are these conditions or indications for later putting the child to the breast from the side of a child? They are asphyxia of newborns, suspicion of intracranial birth trauma, unsatisfactory general condition, deep immaturity, defects of the development, persistent regurgitations, and children born from rhesus-negative mothers in case of developed hemolytic disease of newborns during first 7 to 10 days due to some recommendations. They may be recommended not to be applied to the breast, but to be fed with the donor's milk or sterilized mother's milk or artificial formulas. Later on, they will be gotten back to the breast. And from the side of a mother, indications for later application of the child to the breast are operative interventions in labors, preeclampsia and eclampsia, voluminous or profuse bleeding in labors, and infectional process. Sometimes we also may have situations when breastfeeding is completely contraindicated because it may be associated with dangerous conditions, dangerous for mother and for a child. So if we're talking about mother, which condition of mother are contraindications to breastfeeding in general? So they are decompensated conditions in the mother, oncological pathology, infectious diseases such as tuberculosis, syphilis, tetanus, intake of cytostatics and radioactive drugs, skin diseases, psychiatric disorders. Contraindications for feeding from child side include phenylketonuria, galactosemia, leishmaniasis, alactasia, hypolactasia. In these cases, the child is transferred into free milk diet on the basis of milk or almonds or soybeans or special formula. Which problems may arise out of breastfeeding? The first and the very quite widespread situation, the pathological condition, it is called hypogalactia, and actually that is decreased secretory activity of the mammary gland. It may be classified into early and late, and primary and secondary. Early is usually developed within first 10 days of child's life. And if it arises after 10 days of child's life, it's called late. Also, it may be primary and secondary. If we're talking about primary hypogalactia, usually it's early one, and usually we're talking about the complete absence of milk since the moment of birth. It was never present and it didn't actually appear in the breast milk. It didn't start its secretion, and usually it's associated with some hormonal endocrinological problems or some very severe stressful factors. And if we're talking about secondary, usually secondary hypogalactia is late, and it's associated with, again, stresses, physical loads, with some diseases, and so on and so forth. What are milk insufficiency signs? They are divided into reliable and possible. Sometimes we really, being a pediatrician, we need to understand on the examination, during the communicating with parents, with mother of the child, either there is sufficient amount of milk and either the child is normally fed, either he is not underfed. So what are reliable criteria? First of all, it's poor body weight increase. So the child is not gaining the weight. Of course, sometimes it may be caused by some diseases, but if there are no evident disease signs, and if in general the child is looking well and he doesn't seem to have any evident signs of diseases, but he's not gaining the weight, so probably you need to think that underfeeding is probably reason of this. And secondly, rare urination. Rare urinations also may be a reliable sign of being underfed. And possible criteria. In this case, when you find out one of these signs, you can suspect insufficient of milk in the breast, but it's not for sure, we can say. So the child is refusing from the breast. There are various reasons why it can occur, but one of them is insufficiency of milk in the breast. Anxiety almost all of the time, and prolonged feedings. Factors which have no influence on lactation: age of mother, mother's sexual life, menstrual discharges, disapproval of relative of neighbors, returning to the work, child's age, cesarean section, and having many children. So if you hear that one of them is related to decreasing of production of milk, lactation, you should understand that it's absolute. You need to be ready to explain this to breastfeeding mother. What should be done in order to restore lactation? So if mother has decreasing of milk in her breast, what can she do? First of all, adjust mother's adequate sleep. It's very important because sometimes hypogalactia is caused by stress, by exhaustion of mother, by tiredness, whether she is constantly needs to feed her child and then to do her homework and so on and so forth, and she doesn't have enough time to sleep to restore her forces, her potential. So sometimes in this situation, everything you need to restore adequate lactation is just to provide her with adequate sleep. The next position, regulation of alimentation of the feeding mother. Milk is secreted out of not just water, but also nutrients. And breastfeeding women should completely be provided with all necessary nutrients to be able to transport them into the breast milk and to make the child receive also these nutrients. Thorough and regular expression of the breast milk. The best stimulation of lactation is pumping out of the breast milk or sucking out by the child, right? Use hot shower on the mammary gland and repeated expression of milk after. It also may help. And mammary glands massage. Medical remedies used for lactation restoration, actually, they are very alternative, and in different countries they are different. But what can be in general used: nicotinic or glutamic acids, vitamins E and C, pyroxan, intramuscular introduction of lactine and mammothizine, sulfuride, phytotherapy, acupuncture, ultraviolet radiation, and another methods of physiotherapy. Another problems which may arise during lactation: galactorrhea. Actually, this is almost opposite thing to hypergalactia, and it means spontaneous outflow of the milk. Tight breasts may complicate also lactation, the process of breastfeeding in general. Incorrect form of nipples, you will find it out on the photo. Scratches and chops of nipples, I have explained why, because it's associated with an extreme pain, and sometimes mother should interrupt feeding the child with this breast on the nipple of which there are fissures and chops of nipples. And mastitis. Mastitis, I would like you to understand that it may be of two forms. It may be catheteral mastitis, and it is also purulent mastitis. So if we're talking about catheteral mastitis, actually it's not contraindication to breastfeeding if there is no pus present in the milk. But if you find out some purulent discharges of either yellowish or greenish color, you should understand that it's already purulent inflammation, and its indication, it's already contraindication to breastfeeding until you treat completely this mammary gland, which is infected with bacterial microflora. You can't feed the child from this breast. So you're going on to feed the child with one healthy breast. At the same time, you're pumping out the breast milk from the affected one. And when you completely treat it and there is no more pus present in the breast milk, you may go on feeding your child with the breast. Here on this photo, you can find out problems of the nipples, which can complicate feeding with the breast. You can find out how flat nipples look like, for example, on the third picture. And from the right, you can find out the plastic applicators, which are applied to the nipples of this weird form, and they can make the process of breastfeeding possible and easy. Why? Because they replace the absent, we can say, nipples, the absent shape of the nipples, and the child may be easily fed through them. This is mastitis. So actually, if we're talking about catheteral mastitis, which is in majority of cases caused by microflora, and it's developing on the background of stasis, lactostasis. Lactostasis is a pathological process of staying of milk with its inability to go out of the mammary ducts. So feeding the child in case of catheteral mastitis even promotes improvement of the condition, because it stimulates, it promotes, it decreases lactostasis, makes it easier for mammary ducts to empty, decreases lactostasis, decreases pressure, that improves outflow of the milk, and in general improves condition, decreasing the pain, and decreasing the duration of the disease. So that's why if we're talking about Catheteral mastitis or breastfeeding is not contraindicated, but it's even indicated. Pathological conditions of a child which may complicate feeding include mouth and palatal clefts, Pierre-Robin syndrome, which is a combination of swallow when there is a short frenulum, the movements of the tongue are limited and the child can't normally swallow the food. So actually, in this situation, we recommend very short and very favorable surgical intervention when incision is made, and by this the frenulum is elongated. And as a result, the movements of the tongue are restored, swallowing is restored, and everything is normalized. It's absolutely normal benign operation, and it doesn't require any specific preparations and so on and so forth. Pierre-Robinson syndrome. So that is how it looks like. It is a congenital defect when the child has very small chin, and it also influences the process of swallowing the milk. So actually in this syndrome, only sometimes also tube feeding is recommended because the feeding through the oral cavity may become absolutely impossible. And this is candidose infection of the mouth. One thing you should be ready to do to differentiate between fungal infection of the oral cavity, moliniasis, and absolutely normal condition when there are some milk or formula parts left immediately after food intake. So what is the difference? Here, like you see it on the picture, you will never see it in normal situation. It can't be the rest of the food left in the oral cavity. It can't be situated everywhere. The rest of the food are usually covering the tongue and usually are not present for more than 1 hour. Включить демонстрацию. Як її включити?
Дивіться, Анастасія Олександрівна, ви чуєте мене?
Так, слухаю, Діана.
Там внизу має...
Та в мене внизу, там де справа, нічого немає взагалі. Я клацаю, в мене просто перемикаються слайди. Так, зараз спробую. Справа в тому, Діана, що в мене все включено. І мікрофон включений, і відео включений. А ну, давай так попробуємо ще раз. Видно зараз? Видно зараз, Діан?
Да, видно зараз.
Так, видно, так? Я продовжую. Окей.
Да.
Ага, дякую. In case of moliniasis, it usually covers both mucous membrane of the lips, tongue, palate, and and all parts of the oral cavity in general. The rest of the milk after feeding are present just within 1 hour or a little bit more, and they don't occupy so much place in general. They may cover just the tongue and usually live in 1.5 hour. And their quantity is not so big. It's not associated with pain. It's not associated with hyperemia, hypersalivation, and it's not doesn't cause pain during sucking the breast. Another important thing to memorize is the time of breast milk storage. Sometimes when breastfeeding woman, mother, can't actually feed her child every time, but because she is working, she needs to pump out the breast milk, and someone, a nurse or some of the relatives, will feed the child when mother is absent from the bottle. We need to know the basic principle how to store the milk. So you need to remember, if you are storing it in room temperature, it's okay to store it within 4 hours with maximum of 6 to 8 hours of very cleanly expressed. If you're storing the milk in the fridge, it can be done up to 4 days with maximum 8 days if very cleanly expressed. If it is stored in the freezer, so it may be stored up to 9 months, and it is stored in deep freezer up to 12 months. Even in 12 months, it's absolutely okay. And weaning. What is weaning? The thing is that, as we have mentioned, it's okay, absolutely okay to feed the child with just the breast milk during first 6 months of child's life. But at 6 months, all nutrients which are present in the breast milk can't cover all needs of the child in all necessary substances. That's why we need to enrich the ration in order to provide the child with everything actually he or she needs. So weaning are actually, in other words, solids, which are introduced in the ratio of the child approximately at the age of 6 months, or sometimes it may be also earlier if the child shows the signs of readiness to receive solids. And usually it's needed to improve digestion, to stimulate peristalsis, to stimulate jaw formation and to cover all all energetic needs and nutrients, and to provide the child with fibers. So actually, that is what we have discussed. Why should weaning be introduced? That's because breast milk quantity is reduced, quantity of proteins, carbs, and fats doesn't correspond to 6 months old child's needs, and increased needs of a child in minerals and fibers. Why should weaning be introduced? This is because of absence of cellulose, that's the same as fibers are, what we mean in the breast milk, mastication formation, speech development, habituation to another kind of food, and actually to start formation of normal skills, normal traditions of food intake. And very important thing, I have mentioned that in majority of children, we start introducing weaning at the age of 6 months. But sometimes we may do it earlier, and earlier it means starting from 4th months, but only in case if the child demonstrates the skills of, not even the skills, the signs of readiness to receive principally another sort of food. So you should know these signs. You will be asked during your practical classes and on summarizing module control as well. So what are the signs of readiness? First of all, when the child explores objects with mouth, it demonstrates that he is ready to taste something else apart from the breast milk. When the child is sitting with support and good head control, it's important. The child is sitting, the child is prominently holding his head. Taking an interest in other food, how can the child show it? For example, you are sitting near the child and eating, and you are taking the spoon with your food to your mouth, and the child is following the spoon which you move with his side. So it may be an evident criteria that the child is interested in what you are eating. And demanding milk feeds more frequently when it's not enough, again, to have 3.5 intervals between each food intake, and you see that in absolute normal and adequate quantity of milk, the child is hungry, he wants to eat, and sign of and a sign of readiness to weaning introduction. And also another thing, you know, that before 4 to 6 months, the child usually has the movements with his tongue, like pushing out from the mouth. For example, you're putting the spoon inside his mouth, but he has a reflex of pushing the spoon out. But when the child is maturating and when the child gets ready to receive another sort of food, like solid food, he stops doing it and he is not anymore pushing the spoon out. So again, this is a sign of readiness of the child to receive solids. So how we need to organize? First of all, and the first principle you should remember, that solids are always introduced when the child is absolutely healthy. When the child is demonstrating the signs of readiness for receiving the solids, when the child is not of course at the day of vaccination, not when, for example, you have left the country to another exotic country with when the child needs to be acclimatized after you arrived in this country. So everything should be absolutely okay. No stresses, no loads, no diseases, no vaccination at this day. Like these principles should be adhered. And we start usually with vegetable puree or milk porridge. That kind of solid which you choose for first introduction might depend on some factors. For example, if the child has a little bit lower body weight than, for example, he should according to his age, you may start with milk porridge. And vice versa, if the child has constipations, or some metabolism, bloating, you may start to introduce vegetable puree. If the child is absolutely healthy, it's of no reason what you will start to introduce weaning with milk porridge or with vegetable puree. So every time, no, actually starting from 6 months, the child should receive food 5 times per day. 5 feedings. We never give weaning up to the end of the first year of life on first and last weaning. So usually, in majority of cases, we recommend to start for second weaning, for second food intake weaning introduction. Usually, this is approximately 10 a.m. And independently on which kind of food you are giving the child, either there is a porridge or there is vegetable puree, you start with only 1 teaspoon. You give 1 teaspoon, and after that, the child is fed with the rest of this food intake. He is receiving breast milk from mother's breast or artificial formula from the bottle. Next day, the quantity of weaning is increased on 1 teaspoon, and the child receives 2 teaspoons, and the rest with the breast milk. And the principle is that every day the quantity of weaning is increased to 1 or 2 even teaspoons, and the quantity of the breast milk given after is relatively correspondingly decreasing. So every day the quantity of, one more time, of vegetable porridge or vegetable puree or milk porridge is increasing, and the quantity of breast milk is gradually decreasing until you completely introduce first weaning. Usually it takes you approximately 12 to 14 days to introduce first weaning. Then you start introducing second weaning. If the first weaning was vegetable puree, so the second weaning should be milk porridge, and vice versa. If the first weaning was milk porridge, the second one should be vegetable puree. Usually you start doing it on fourth feeding. Fourth feeding usually occurs approximately at 4 p.m. And again, the principle is absolutely the same and identical. You start with 1 teaspoon and gradually increase this quantity on 1 teaspoon every day, and with parallel decreasing of the quantity of the breast milk given after. When you completely introduce 2 weanings, we have third weaning left, because totally there are just 3 weaning, because first feeding and last feeding are still breast milk up to the end of the first year of life. So what can be third weaning? Third weaning may be either second vegetable puree, or it may be already, for example, soup puree, because the child already reaches the end of the 6th month of life, because third weaning is ordinary, usually introduced at the end of the 6th month of life. And it already may be soup puree with added meat inside, for example. Or it may be another milk porridge. The principle how you introduce third weaning is absolutely identical to how you did it for first and second ones. What you should remember, on which milk can you can you cook milk porridge to a child? Usually we recommend to use milk formulas with this aim, or breast milk if it's possible to do it with this aim, because cow's milk is in general not recommended to the end of the first year of life because of a lot of allergic determinants which are present there. There are more than 32 antigen determinants present in the cow's milk. So that is why it's not a good decision to use it for cooking the milk porridge in the first year of life. So that is why you are choosing milk formulas, or you are choosing breast milk if we are talking about enough breast milk in the breast to cook the porridge. We are not using the next cereals such as wheat, such as rice. Why? Because they are gluten-containing ones, and they may cause some adverse effects from the small intestine's mucosa, increasing its permeability and causing some maldigestion, some malabsorption. That's why, due to this risk, we are not usually doing this. Yeah, we are trying to avoid these cereals in the first year of life. But all another ones like buckwheat, like rice, like maize, like oats even, we recommend them as first, second, and third porridges to be introduced in the ration. If we're talking about vegetable, which vegetable is better to use? Actually, there may be zucchini, carrot, potato, and so on and so forth, broccoli, and any other kind of the cabbage. But when we start to introduce vegetable puree, it should contain just one type of vegetable. We call it mono puree. We mean that only one component should be present. Why is it so necessary to do that? Because you never know what will be the reaction from the child's intestines. And you should be ready to understand that this reaction had developed on this exact vegetable. Because if you give the child, if you feed the child with polycomponent, and cause development of this adverse reaction. So that is why during first months of life, it's better to introduce one component vegetable puree. After the child gets used to this one component, you may try another monocomponent vegetable puree, and only starting from 7th and even 8th month of life, you may already cook polycomponent vegetable puree. Also, it's important to understand that it's of great importance to provide the child with necessary fat compound. So the fat quota of fat is provided by the olive oil, which is usually traditionally added to the vegetable puree, vegetable puree, and by butter of 82.5% of fattiness, which is ordinarily added to milk porridge. When the child is more close to the end of the 6th month of life, you need obligatory introduce meat to his ration. Why? Because the iron deficiency, latent and evident one, both of them, are quite widespread condition among our children's population on the first year of life. So that is why, in order to prevent this condition, you need to provide the child's organism with enough iron, and the meat and the liver of animals is the best source of iron. That's why you need to start introducing it in homogenized, absolutely homogenized condition added to vegetable puree starting from the end of the 6th month of life. And later on, of course, we gradually expand the spectrum of introduced different food substances. What can they be? For example, when the child already has 2, 3, 4 teeth and may already chew, you are giving him, for example, a piece of bread or a piece of cookie. They should be soft, and you should be ready to understand that the child will never aspirate them and willing to be suffocated. And willing, for example, it shouldn't be too solid in order not to harm his his soft mucous membrane of his oral cavity, and so on and so forth. Then not just vegetable puree, but you expand the ration with soup puree, with polycomponent porridges, with polycomponent vegetable puree. Usually when we are talking about fruit, they are given as additive, auxiliary, some, we may say, delicates, and they are given between food intakes, and they are not calculated into calories. That's why never think that if you gave your child banana puree, just banana puree, you have fed the child. No, vegetable puree is normal, absolutely adequate food intake, and the same about milk porridge, but banana is usually in between. Apple puree is given in between. They give enough water, good quantity of fibers, vitamins, microelements, but in case, if we mean caloric load, they don't give a great caloric load. And we can't give, for example, 2 grams of some fruit puree to feed our child. So they are not calculated as weanings, just as some accessory foods which are given in between basic food intakes. About juices, World Health Organization is not recommended now to give any kind of fruit juices to children on the first year of life, and you should memorize this. This is related to high rates of obesity in children because fruit juices are sweet. Children like them and they drink them willingly, and sometimes they interrupt their normal appetite, and the quantity of food they eat after is significantly decreased. So this is another reason why they are not recommended, and because of caries, because nowadays it's a great problem because children develop caries starting from the first year of their life. But starting from the second year of life, we start giving already 30 milliliters of juice, and no more than 30 milliliters of juice. And then with each year, the quantity of juice is gradually increasing. But in general, there is recommendation to maximally limit it or even not to give the juice if we can replace it with something else. So that is why if your child is willingly eating whole fruit, whole berries and fruit puree or berry puree, it's better to feed the child with these substances but not with juices. This is actually how approximately the feeding scale of the child may look like. This is taken from American side, and actually that is how it's traditionally present, how it looks like in the ration. But actually you may also keep it in the memory that it may look like here. Diary, it's very important to remember about sour milk products, such as soft cheese, such as sour milk, such as yogurts, kefir. They are very important products. They are rich in calcium. Too much calcium on the first year of life is not good because calcium may create insoluble substances with different minerals, proteins, fats, and these conglomerates of insoluble substances, now they are just discharged from the intestines with feces. And that is not good because calcium is not absorbed and these nutrients are not absorbed. That is why the quantity of dairy products are a little bit limited on the first year of life. And you will receive scales, and you will see them in your books, where the certain amounts of recommended dairy foods are noted, are marked, and you should remember and adhere to these recommended amounts and never exceed them up to the end of the first year of life in order not to promote development of constipations in infants. But in general, dairy products are very important and very needed because they are donators of good probiotics. That's why in general, there should be, of course, obligatory present in the diet. So actually, that is everything we needed to discuss today. I wish you good luck, and we will discuss all these points more profoundly during our practical classes. Thank you for your attention. Діаночко, все нормально?